About 6 years ago, when the Republican majority in Austin committed to Texas that we were going to reform public education, I had a city council member in a town hall meeting stand up and say, we're never going to answer that question until we define education in Texas. Everybody's got a different idea about how to fund it because we don't know what it is. Are we funding textbooks, or what are we paying for? And I went back to the Constitution. I quoted that a minute ago, almost verbatim. In order that our children would understand liberty, the state of Texas will provide a free public education for the general dissemination of knowledge. We look at the growth and the cost of public education in Texas. We look at the fact that the outcomes were ranked 47th in the nation. And I look at the fact that we've got independent school districts, and I say independent of what? Competition provides the best products and services for the least cost available to the most people. Should we be, as Texans, defining general dissemination of knowledge? What is that? Some of you would argue it's reading, writing, arithmetic. And a few more of you would say, well, no, it probably needs to include science and history. Some of you might say, well, it also ought to include a foreign language, and I'd begin to argue with you that that's not general dissemination of knowledge. It gets broader than that. The state's job, according to our Constitution, is general dissemination of knowledge. Do we get back to a place, not overnight, but do we move back to a place where that's what state revenue pays for, your revenue that's taken by the state that comes back to your public schools, and everything else is left to independent school districts? When I had that conversation in West Texas, there were some businessmen out there that said, man, there's some real opportunity there. Do you have industry in your community? In my community, it's farming. And there's a co-op there that would probably chip in and pay for a diesel mechanics class at the local high school because they know kids need diesel mechanics. I bet you've got industries here who would want a petroleum engineering class or a math class because they need, and they fund the teacher to teach that class. Or do you have parents paying tuition for the things that they get beyond the general dissemination of knowledge? What does that competitive environment look like? But education in Rockwall didn't have to look like that in El Paso or Corpus or Tyler. The state's job is general dissemination of knowledge. You get back to independent school districts that are figuring out, and parents that are participating in what the rest of that is. We get innovation, we get a competitive market in public education, and our children will dream again and they'll be successful.
Sorry, the time is getting away from us, and we're only going to have time for one more question. But the rest of you that have questions, if you will, leave your question at the table back there. We will get an answer for you. Leave us an email address. We will send it to you. Or if you need, leave your phone number, and I'll be glad to call you and relay Debra's answer to this question because it's important to answer your question.
Well, I apologize for being the last person to ask your question, but this is healthcare. And being a fellow nurse, I have to ask this. Nullification. What kind of impact is that going to have on reimbursements with Medicare, Medicaid coming from the federal government? We have a lot of big hospital systems around here in the state. I'm new to Texas. So how is that going to impact reimbursements for our state, and how are we going to pay for that kind of care if they decide to pull the money out?
Are you talking about nullification of the federal health care bill that's being proposed now?
Yes, the health care plan.
We had that conversation with the congressman. For those of you that are not nurses or health care providers, elderly in this country frequently are insured by a federal health insurance plan called Medicare. Indigent, low-income individuals are insured by a state, primarily state-funded health insurance program called Medicaid, but the federal government contributes to the Medicaid fund, and so it's partially federal, partially state. Those monies, however, come from the government, either the federal government or the state government, to the provider. The doctor sends a bill. I'm a nurse, but I run a medical billing company. I send a bill to Trailblazer Health Enterprises in Dallas, Texas. All doctors in the state of Texas sending in Medicare bills send them to Trailblazer, and they use federal money to pay the doctor. It does not flow from the Congress to the state to the doctor. It goes from the federal government to the healthcare provider. And so my presumption when I had the conversation with that congressman was that nullifying the health care bill would not impede that flow of revenue. And he agreed with me that that's true. They cannot cut off the faucet to doctors because a state decided they weren't going to participate in the federal plan. They can restrict the flow of Medicaid money from the federal government to the state, which would impede our ability. We've got some serious problems there with or without that impediment. But where the congressman expected the wailing and gnashing of teeth from Washington when we nullify health care here is to cut off community development block grants. Look at what's going on in your city and your county, and you'll see that they're spending a lot of money sending lobbyists to Washington, D.C. to try to get a grant to fund various things in your community, and recognize that when we stop, they're going to try to stop that funding. President Reagan and President Eisenhower both recognized that we were headed down the wrong path as the federal government began to fund more and more things in the states. They get that money from us. So they take it from us, and then they give it back to us, and they have all these hoops that we have to jump through to get our own money. And Eisenhower and Reagan recognized that was bad policy, and yet at the same time you can't cut it off overnight. And they advocated using block grants instead of categorical grants to begin to fix that process. I think there's a real opportunity there. Reagan had some success with that early in his administration, lost the vision, lost the impetus there, and it hadn't been back in Washington since. But the block granting process works something like this. We decide that there's going to be X amount of federal money coming to Texas for health care, and they write a check and don't ask any questions. Here's your health care money, Texas. Y'all decide how you're going to spend it. We've got to put pressure on the Texas congressional delegation. We'll have other states, I think, standing with us in that regard as well, to begin to say, that's our money, give it to us. You're not going to tell us how to spend transportation dollars. You're not going to tell us how to spend education dollars. You're not going to tell us how to spend health care dollars. When that money comes to our state, our legislature and our state offices will determine how to spend that. But complex, good question. Don't see, and the congressman did not see, now that's not the final authority, but on first blush, from a congressman who's up there and familiar with it, a guy who sat on the bench, and from a nurse who does medical billing, it's our belief that it will not impede the flow of Medicare money. It may hurt Medicaid. It's more likely for them to try to squeeze on community development block grant. Thank you all so much for this evening.